So, Dr. Sundar, what would be the treatment process? Like in some cases, lot of cases, patients actually recover from the fever and the body ache after taking the medicines. But yes, what should be the course like? And even after recovering from fever and body ache, the proper medication should be continued to actually ensure that malaria is not there in the body.
Yeah, that's a very valid point that you make. One of the major problems we face as healthcare providers is people not taking medicines and completing the full course of therapy. Because somehow there is a tendency that one tends to take the drug and then one starts feeling better.
Yes.
One starts stopping the use of the drug. So that's something which I think we will need to educate people that they should not be doing in cases of diseases, especially like malaria. Now, why am I saying that? So now let's say we have a patient with malaria. There are various modalities which exist for treating the disease. So you could give oral drugs for some patients who have simple, uncomplicated malarias who can be treated at home. There are oral medications that are available. There are a variety of oral medications which are available, which a doctor would probably decide for you. And these can be administered and taken safely. Supposing a patient needs to take intravenous drugs, so there could be those patients who would probably be complicated or would have severe symptoms, or they may not be in a position to consume drugs because of probably repeated episodes of vomiting or things like that. Such patients who are admitted in the hospital would require intravenous drugs. So these are various IV drugs. We get drugs which are given through the parenteral route. We call it oral and parenteral. Oral is when we give it through the mouth, and parenteral when we give it through the IV or the intramuscular apparatus. So these are drugs which can be given through that means. And in addition to these drugs, there are also other supportive therapies you might require. So a patient who's probably having fever, you may need to give intravenous paracetamol. You may need to give, if a patient is vomiting, you may need to give IV medications to stop the vomiting from happening. If he's having low blood pressure, you may need to give IV fluids to such a patient.